Now to Georgia's record-breaking coronavirus numbers. Today, the Department of Public Health reported 1,900 new COVID-19 cases.
On Saturday, we saw those numbers first jump with 1,800 cases, and they have remained high ever since. Investigator Rebecca Lindstrom looks at the impact this is having on our hospitals.
On Monday, we started to see a consistent rise in the number of people who were being treated at the hospital for COVID-19. You've probably seen this number for hospitalization. The Department of Public Health says as of today, 10,605 people have been diagnosed with COVID-19 while in the hospital. It's a cumulative number, and it fluctuates a lot from day to day. There were 148 new diagnoses reported today. So that's why I pay more attention to this number provided by Georgia Emergency Management. It tells us how many people are currently receiving care. The higher this goes, the more strain on our medical system. But I wondered how this number was moving in relation to the significant increase we've seen in positive COVID-19 cases. What I found here is a bit of good news. If you look at 2 weeks ago, when the number of active patients was going down, it suggests 16% of new COVID cases were seeking medical care. Now compare that to the past 7 days of this week, and even though the numbers are rising, as a percentage of new COVID cases, only 10% may be needing hospital treatment. We don't know when those hospital patients arrive, so some have likely been there for weeks. These percentages are just a ballpark. But it does match other data I have found that shows more younger, less ill people are getting tested, accounting for some of that spike we're now seeing in COVID-19 cases.